All right. So good afternoon, everybody. So we're going to be talking a little bit about golf and your golf injuries and really preparing yourself to get back to the course. As Claudia had mentioned, we have my guest today, Dr. Andrew Creighton, assisting attending physiatrist at HSS, and quite the competitive amateur golfer. He's got a great swing. So hopefully there's a boatload of information you guys will get out of both of us for today. So let's dive into it. Should we start with the first question, or do you have any opening remarks?
No, Jamie, I just wanted to, thank you and Claudia. Thank both of you for the introduction, and I'm really happy to meet and talk with everyone today. And I'm sorry it has to be kind of like this. I'd love to talk to everyone in person. I think my focus today is to hopefully give people, a few things they can take away from the talk and maybe implement somehow into their life, into their game. So hopefully, we're successful with that today.
Yeah, perfect. All right. All right. So let's get into the first question. Let's dive into things. So what is some of the primary joints and areas of the body that are subject to injuries in golfers?
Yeah, so this is interesting. I think the short answer is many, and all even can be affected. But I think what we see probably the most of, and depending on where you read, I think the interesting thing is there's not a lot of great epidemiologic. So, studies that look at, what genders are most affected, what, certain swings, result in injury, and what injuries are most common, and that type of thing. So there isn't a lot of great data to suggest that, there's X amount of this and X amount of that. But I think that, the most recent systematic review that I looked at quoted the low back as being the largest area, which fits kind of with what we see kind of in the world, which is that, low back pain is really the number one cause of disability. And so it stands to reason, or makes sense that the low back is kind of the marquee area, even in golfers, that's affected, but pretty close second. And some would say in the professional golf ranks, hand and wrist injuries are also really, really common. And
Yep.
so I would say kind of 1 and 2, 2 and 1, low back and hand and wrist are kind of the primary joints affected. I think, and we'll get into this a little bit, but you have to think of the body kind of connected. And so, obviously other areas in relation to that can be affected, but those are kind of the two marquee areas you hear about.
So maybe more focusing on low back for the first injury point. So how does the lower back typically get injured in a golfer? And is it usually the primary reason why it's getting injured, or is it some other components to it? Can you talk to the points of kind of why people injure their lower backs when they're playing golf?
Yeah, so I think in general with any injury in golf, and definitely with the low back, I kind of bucket it into, an overuse issue or like an acute traumatic issue. And I think that far and away the most common, if I had to give you a number, probably around 80%. I think one of the guys that I train with in kind of my medical school training said, if you never know the answer, it's either 80% or 20%. So I think the vast majority of golf injuries, though, and definitely what we see, are overuse. And then, the lesser so is with traumatic. Now with the low back, I think, oftentimes there's a famous neurologist that said, the person that treats the site of injury is a little bit lost. And that's sort of true for the low back. A lot of times the low back is almost the victim to the issue. And oftentimes we see, for instance, that the hip is kind of a major contributor to low back pain. Specifically, a lack of hip range of motion oftentimes can result in the low back rotating maybe more than it should, and oftentimes resulting in low back injury. So I think probably the most common thing that I see is that when patients have low back pain, it's actually more of an issue of mobility at the hips and even above where the low back is in the thoracic spine. So those two areas should be moving more than the lumbar spine does. But unfortunately, what we see a lot of is that people have poor mobility through the hips or poor mobility further up in their spine, and that oftentimes can lead to issues in the low back. So that's kind of the most common reason I see the low back getting injured. Now, obviously the low back can get injured from, from all sorts of things you do in your day-to-day life. I tell people that the back in general hates bendy, lifty, twisty things. So, if you're doing a lot of that, even in your day-to-day life, that's not probably helping you or setting you up well, even before you go to play golf. But, I think being conscious of, even on the golf course when you're not swinging, how you're moving, when you go to pick a ball up out of the hole, really making sure that you're bending the right way and hinging at your hips. And so, but that's, if somebody came to me with low back pain, I would look at their thoracic spine. I look at their hips right away. So.
Got it. So really, the low back is more of a stable joint in the golf swing,
Yeah.
and more of the mobile areas, which could be restricted, and then the lumbar spine sort of takes up the slack for that rotary component. Seems
Yeah.
like. Got it. So next question, and probably one real great question to ask is, when should you sort of look for doctor's advice in the event that you sustain an injury on the course? Kind of what sort of things should you be looking for in the event that you sort of maybe feel something in your lower back? So when should you sort of reach out to a doctor, would you say?
Yeah, that's a question I get a lot of, and it's a little tricky, obviously, just because it does a little bit depend on what's going on in the situation. But I think if you're going to take away any sort of things to think about, if there was a trauma, so if you were in the woods and you weren't seeing that there's a tree root right near your golf ball, and you swung the club really hard, and you impacted the tree root potentially even before hitting the ball, kind of felt a sudden amount of pain, that might be a reason to go see a doctor. I don't think there are any absolutes, I wouldn't say, but these are kind of the things that I'm mentioning here are kind of some things that may key me in to say somebody should see a doctor sooner rather than later. So trauma, if somebody has joint swelling or decreased range of motion, that especially if that's acute, I think that's something that would prompt me to recommend that they go see a doctor. The other thing is, and one of my mentors always says, pain worries you, weakness worries me. And that's really true, especially I would say if we're talking about a neck or a low back injury. Oftentimes we see patients that have low back pain along with pain radiating down the leg. And that's a pretty common issue. But I think when it's associated with weakness, that's definitely something that you want to talk to someone about, because that may be a sign that there's some neurologic change going on, whether that's damage or injury. A couple other things: if someone's limping, limping is always something that one can affect. If you're limping, that can certainly affect other areas of the body in terms of how you're moving. And so limping is another thing. And then the last thing is that, if you think you have like a little minor ache and sprain or strain, and you're doing all the basic things like modifying your activity level, medications, PT, but you're not turning the corner, and it's almost, if not plateauing, getting worse, then that's another scenario where I would suggest that maybe consulting with a physician would be a good idea.
Got it. So really, any weakness or neurological symptoms,
For sure,
reach out.
definitely, that's a
Yeah,
big
yeah, yeah.
that's a big one.
Sooner than later, I'd say.
Yes,
Yeah,
exactly, 100%. Yeah.
yeah, yeah. I actually, a quick story. I had a friend that had tweaked his back playing golf. Had neurological symptoms, ignored them for a good 2 to 3 weeks. He actually ended up needing surgery, but it was really on the fence if he was going to get better. He had a drop foot. So definitely scary stuff. So I think the moment you start feeling anything like that, it's
Yeah, that's a really good point too, is that there are certain areas where if you're weak, it can be incredibly functionally limiting. So if you're a little bit weak in the muscle that kind of helps flex your hip, for instance, that may be something that you kind of, um, you know, listen, if you have any weakness, you should definitely talk to a doctor, but that's something that maybe someone would be inclined to watch longer than, as you mentioned, foot drop is really functionally limiting. That can lead to falling. And that is something that really can limit your just ability to ambulate and walk, obviously. So really good point.
yeah. So now that we're in a nice quarantine isolated
I know.
situation,
Crazy.
how could yeah, it's been nuts. I don't know how many putts I can roll in my living room. So how can golfers maintain their game while they're currently isolated and stuck inside? So what are some of the things that they should maybe be working on? I would imagine, mobility exercises could be one, but anything else that you'd maybe suggest?
Yeah, so this is obviously really unprecedented times, and scary times, and so I think we all want to go to our happy place. So that, for many of us, including me and you, Jamie, I know is the golf course. So
Yeah.
so it's interesting. I've talked a lot to my brother about this because he plays professionally, and he's down in Florida right now in Jacksonville, and their courses were closed and they were open, that type of thing. So
Yeah.
I've picked up about this too, and I think it's similar to you. You do, in many respects, want to do similar things than if you weren't quarantined. So there's a lot of exercises you can do at home. I think one of which is just being aware of your posture. I think one of the things I've seen for the last month, I've done a lot of these virtual visits, and people are having, I think, a lot of issues, reoccurrence of their pain, just because everyone's sitting a lot. We're not moving, and
Definitely.
so we're sitting and we're in a rounded position. I think people need to be aware that sitting loads your spine more than standing, and uh, you know, you're sitting in oftentimes in poor posture, and so that is I think a simple big contributor to why people are having issues. I think that other things to think about are, doing exercises again to work on. We kind of got at this earlier, but I think people, we've talked before, Jamie, but I think there's
Yeah.
a thought out there that a simple way to think about kind of where in your body should be mobile, where should be stable. You kind of start up from the ankle, and you think about the ankle as being more of a mobile joint, knee
Mhm.
as being more stable, or a joint that you don't want to be moving as much, hip more
Mhm.
mobile, lumbar spine stable, thoracic spine mobile. So it goes kind of sequentially up, and I think that you want to train that mobility definitely first. So I think work on ankle mobility, hip mobility, shoulder mobility, and then also really, really, really prioritize the core and core stability. So the basic exercises that I give people for that require no weight or weight room at all. Uh, Three that have been shown to really spare the spine, but also really target the core, the McGill Big Three. They're a basic set of exercises. Um, I don't think we'll get into like all of that today, but basically, I think doing all the things that contribute to a good golf swing, or being aware of that. So good posture, training that mobility, training that stability with different exercises, and then the last thing is something that my brother's been doing a lot of, which is using the mirror. So oftentimes, a lot of us have mirrors at home that span further segments of your body. So one of the things he pointed out to me was, it's never bad to just train movement without even having to see the result. So I think standing in front of a mirror and kind of just working on your golf swing, obviously being aware that your wife and or husband and kids are not around, and you're not going to take out a lamp or something like that. But
Yeah.
being aware of your surroundings, but the mirror and even taping yourself can be really, really, really helpful, I think, with golf. So those are
Yeah.
kind of some things
Yeah.
to think about. What do you think?
Yeah, I totally agree 100%.
Yeah.
I love the mirror feedback. I think when you can see something and feel where you are in space, right, then over time you don't necessarily need to be seeing it anymore, because you have that reinforcement of kind of understanding where your body is in space. So, and even if you don't have enough space, say you're living in an apartment or you're in Manhattan, I have a little bit of a loft here, so I can swing through
Nice.
here, but I set
Yeah.
up a mirror behind me, but I'll even just work pivots. Cross
Nice. Yeah.
the club across my chest, have a line on the ground so you kind of know where your target line is, and just understanding, the basic pivots. And I think on top of that too, one, it keeps your joints mobile for golf itself. To
Yeah.
that point that you were saying before, people are sitting a dramatic amount more than they ever have in the past. I mean, I never sit this much. It's insane.
It's crazy.
And if you open up your health app, you'll see if you have an iPhone, you'll see your activity levels. I mean, everybody's just dropping off. So I
Yeah.
think now is it's a time that you could either get tighter and less mobile for the game, and prevent, and set yourself up for an injury, or you could really start mobilizing the joints that need to be mobile, like you were saying. And I definitely would say, that core strengthening, to keep the lumbar strong, and that integrity of the lumbar spine, so there's no motion coming from there. I think that's key. But
Yeah.
definitely 100%.
and we've talked about this before, but I think as much as you can kind of, make the training process fun. So,
Yeah.
maybe, take a ball and put a ball in your lower back as you're doing a plank and see if you can make a game out of it, and compete with your significant other maybe, and see who can keep the ball on their longer, make a game out of the exercises that you're doing at home. But and try to kind of externally cue yourself, as opposed to telling yourself, I'm going to try to do this or do that. But play games like that, with yourself. And then I've actually started to set my alarm like every hour, just to remind myself to get up and,
Yeah.
and and move. I mean, like, we got to keep moving. So
Yeah. Yeah. I think that's definitely a great point. I think definitely maybe set an alarm for maybe every 30 minutes, get up, do a movement, whether it's a stretch for the back of your hip, the increased hip, motion, hip, external, internal rotation, whatever it is, but picking a couple different of those mobile areas and the areas that need to be stable. And then doing it throughout the day, I think is a smart way to do it. I
totally
think
agree.
that will keep you a little bit more mobile than anything else. So kind of going a little bit off more into the golf swing. There's a lot of talk about, the traditional golf swing and more the kind of the modern golf swing. So more the classic versus the modern, having more of like a fixed foot position versus allowing your feet to move. Just to talk a little bit on those points. Do you think one is maybe either better for your body or worse for your body? Or, I mean, obviously, I think it's still up in the air. Nobody's
Hmm.
necessarily that sure. It
Hmm.
definitely seems like some of the pro golfers are gaining maybe a little bit more distance by having a little bit more movement at their feet.
Hmm.
So any thoughts on that?
Yeah. So I always preface everything by saying I'm by no means a golf instructor at all. And what I have experienced as well is that, you better be careful if you're ever going to try to modify someone's swing. So if I saw someone, that had kind of a funky looking swing, but, there's this clip of, we may have talked about that. There's this clip of this person winning the Boston Marathon, and their form was terrible. Their running form was awful. And the
Yeah,
question that was posed was, what would you do to help this person? And the answer is nothing, because they just won the Boston Marathon.
yeah,
So, you have to be careful, I think, anytime you look at someone's swing. And I know what my limitations are. I don't know everything about a golf swing, but I think, loosely speaking, the idea is that there's kind of two general ways of swinging. As you mentioned, the classic swing, where kind of as the club is taken back, you see the heel come off the ground, and you also see kind of the pelvis and the shoulder rotation kind of moving in sync. And then there was this um, push to get more power. And the idea behind the modern swing is kind of that idea of creating potential energy, basically. Or think of a rubber band, where you're kind of pulling the rubber band back and really storing up power before you let the rubber band release. And that's where you hear this idea of the X factor. So that's the difference that's created between the pelvis is more stationary as opposed to moving with the shoulders, whereas the shoulders are kind of moving. And that difference is kind of looked at as this X factor. And that's kind of the way you've seen the trend in terms of swings. Now, I think, you know, um, I think the jury's kind of out on that. Kind of like you said, I think while we think that some aspects of the modern swing may contribute uh, to low back pain, I think it probably depends. If you've got a golfer that doesn't move well through their hips, and um, they're they're trying to get really far back in terms of rotation, they may not be able to, their body may not be able to do that, and they may start rotating, as you said before, too much through their lumbar spine. And so I think, depending on who the golfer is, some probably can get away with it. Some others, it may not be the swing for them. But I think being aware of those two trends is really important. And being aware of kind of what each of those swings, uh, you know, kind of how someone swings with each of those patterns. And I think, to your point, if you've got someone that wants to swing with a modern swing, maybe they've got hip arthritis and they can't move really well. They just have strong limitations in terms of their ability to move through the hip. That may be one that you talk about trying in their swing. Um, lifting their heel up a little bit when they take the
Yeah.
club back to generate more mobility through the pelvic area or the hips and take stress and strain off of the lumbar spine.
So
Um,
so it seems like, obviously person specific, depending on age
yes, definitely.
limitations and really biomechanical limitations as well.
Yep,
So I feel like, getting a good biomechanical assessment on yourself and really understanding, what kind of motion do you actually have, at your T spine, at your hips, at your ankle, and then
100%.
trying to kind of adapt around that seems like the direction that maybe
Yeah,
golf should be pointing towards, I would
yeah.
imagine.
Exactly how you said. You don't know what you can't really fix or address something until you do a really good assessment and know what you're dealing with, and that's when you can kind of react and develop develop your treatment approach.
Got it. Got it. All right. So, and any thoughts on just equipment in general, for different body types? I mean, I think obviously golf is definitely driving more towards like fitted equipment for obviously different individuals, but I think when you're talking about more of those kind of wrist and maybe elbow injuries, I think sometimes maybe it could just be more poor fitted equipment. You want to talk a little bit to those points? Obviously, there's different swing weights and there's a lot of science and
Yeah,
complicated stuff that kind of goes into it. But
yeah,
I feel like it could be worth a lot of people's while to get that checked.
definitely. I think there's like you said. I mean, if you go to any of these professional tournaments, there's all these vans that are set up, just addressing golfers' equipment, and so there is an incredible science to it. But I think you're totally correct. I think that the equipment has gotten so good that if you're not looking into, whether it's getting on some sort of launch monitor at your local club or going somewhere and having your clubs fitted, I think that is more than worth your while just because of how good the technology's gotten. But I think that oftentimes people find that, okay, maybe it's just easier to hit with, a graphite shaft as opposed to the steel shaft that was kind of what I always used. And, you know, okay, it's not what I kind of always know is the tried and true, but if I get fitted appropriately with these graphite shafts, maybe it's easier to swing. Maybe the ball goes further, and consequently, I'm having a lot more fun. So I think that is really a big thing. And then there's like you said, there's ways to do things with your clubs, or you get them weighted so they all feel the same in your hand. I think that is really awesome. But yeah, it's really become a science in terms of spin rate and launch angle and everything like that. There's so many different metrics now that there's no way I could do it justice in the time we have here. But I 100% think that a lot of injuries may happen just because patients, a big factor is just their equipment is just not fitted appropriately. So it's one thing that if a patient comes in, a golfer comes in, it's one of the major things I talk to them about is, have you ever been fitted? That may be a thought in terms of, you know, helping your pain and helping your functionality in golfing.
Yeah, definitely for the individual that really likes to practice a lot, right? So if you're hitting
Yes.
a lot of balls, it could
Yes.
really start to add up. Um,
We all know
any
those critters on the range.
Yeah,
You
exactly.
just always
Two,
see banging balls out there.
200, 300 balls. Yeah, right. So those graphite shafts might be a little bit of a better situation, I would imagine, for them.
Yes.
Any thoughts, really quick, on mats versus grass?
Yeah. I mean, I think um, it's a really good question. I think that some of it may depend on, there are people out there that take massive divots, and then there are people
Mhm.
out there that pick the ball. Steve
Yep.
Stricker was always known as the guy that is revolutionized his career, and he's one of my favorites. I love watching the guy play, but if you watch when he plays, he takes he does take divots, but they're pretty small. He's not taking a lot of turf when he's
Oh yeah, tiny. Yeah.
yeah. So, but then there are guys that take a lot of divots, and so you would think that the people that normally take larger divots may have, when they're hitting on those mats, while there's some give to the mats, and if you're going to compare mat to the ground, obviously it depends on, are you hitting off of turf that is like well manicured and they water it every day, or are you at the local club that they
Yeah,
water like once a month?
like
So
concrete.
there's stuff that goes into this, but I think that if I think a lot of it does depend on that aspect of things, and if you got someone that um, is someone who takes big divots, you would think that hitting off of mats would create a lot of force through their wrists and through their upper extremities, kind of throughout their whole body, versus someone like a Steve Stricker, where they're just kind of picking the ball. So
Got
um,
it.
so that would be my just general thought. And someone who takes big divots on kind of well manicured grass, you would think that the grass is giving a little bit more than maybe the mat would.
Cutting through the turf a little bit
Yeah.
easier. So you'd
Yeah.
say those more like over the top cutter of the ball, a little steeper. They may
Yes.
not benefit too much hitting off mats for
Yeah.
too long. Obviously, that may
It
lead to
may
maybe
catch up
some
to 'em.
upper extremity issues or something
Yeah.
along those lines, right?
That's what I would think. Yeah.
So it seems like getting a good biomechanical assessment on your body, right, and then getting an idea of how that would fit with your swing, and then maybe fitting your clubs to your size, the size of your hand, and your strength, could be a nice recipe to play pain free.
Absolutely. I think that's uh, I think that's a good way to kind of tie it up for sure. Yeah.
Awesome. Well, I think that's all the time we have, right? 12:33. Any last closing remarks or?
No, I think that the other things that we don't want to neglect, and it's something that I've talked with my brother quite a bit about, is the basics of making sure you're sleeping well, making sure you are hydrating well on the course. I think most of us are like chronically dehydrated,
Yes.
and so hydration on the golf course is really really huge. And then your diet. I'm by no means a dietitian at all, or an expert on this, but I think there is literature out there that talks about how golfers that their blood glucose levels are maybe not optimized, how that can affect performance. And so I think that whether it's talking with a dietitian or really doing a fair bit of research in terms of how you can maybe optimize that on the golf course, that can itself may be able to kind of help your performance, but also help in terms of um, you know potentially helping prevent injury.
Yeah,
So I think
I
that's
definitely
something
agree.
that is maybe underrated, but is something that I think we should definitely mention.
Definitely, definitely. I definitely feel sometimes when I'm playing, you get to that 12th, 13th hole and you really just need a snack, right?
Yeah,
Because when your blood glucose levels start dropping in, even when you think
you
of
can feel it.
just yeah, and golf, golf's a game between your ears as well, right? So you get a little shaky, you get a little
Yep.
anxiety, right? You want to calm yourself, go back parasympathetic, get some food
Right.
in you,
Exactly.
right?
Well said.
Calm down. Yeah, I feel like you always see the pros doing that. They always have peanut butter and jelly on like the 16th hole,
Absolutely.
right?
The stuff that you hear about is that the main kind of nutrient is carbohydrates when you're playing.
Yeah,
So if you can remember one thing, it's just making sure that, and again, that's how you get your blood glucose levels kind of optimized. But yeah, I don't think we would be doing this justice unless we mentioned that a little bit. So
definitely, definitely. Well, all right. Well, I think that's all the time we have. Thank you everybody for tuning in. Feel free to leave any comments below, and then definitely visit hss.edu/feel better. And also another plug, we also have hss.edu/golf portal, and we definitely have a lot of content on there when in terms of golf and a lot of nutrition actual information on there too. So I think definitely a benefit there.